Indiana Latino Expo Show. Gloria Jimenez.
Celebrating the Hispanic Heritage Month once again here, we're going to talk about a little bit of the area of health with Dr. Saura Fortín. She is the Chief Medical Officer of Primary Care for Eskenazi Health. Welcome, Dr. Fortín. How are you?
I'm doing great. Thanks for having me.
Well, it's we always talk about health and what's happened with the COVID, with women's health. Now we're going to talk about you, Dr. Fortín. Tell us a little bit about your childhood when you were born in Honduras.
Yes.
And how was little Saura when you were in Honduras? Were you as A+ student? How was your childhood?
So I was raised in a small town in Honduras called Catacamas, and I actually went to a public school with all of the other kids in town. We had 2 shifts. We will go in the morning and in the afternoon, so a lot different from what it is right now. Mm-hmm. And I felt at an early age, I learned to appreciate the difference between people and just to see different kind of people, because, you know, some of my classmates actually wore no shoes, you know, basically. And some of them went to school without any breakfast. Not because they choose to, like some kids now, but because they didn't have any. And so that sparkled my interest in people, you know, being really young. And I was raised by my grandparents when I was little. And I was not an A student. Actually, I clearly remember when I was in 3rd grade, not knowing my multiplication tables. And back then, you know, they will put you in a corner so that you will learn the multiplication tables. I'm not sure that worked, but I was always in that corner. And you know, we you know, you don't have to be perfect, but you have to overcome challenges, and you have to always be better than yourself, not necessarily better than someone else, mm-hmm. but better than yourself.
Exactly. And how that, when you were a teenager and you decided, when you were deciding, sometimes you don't know what to be in life, but when you were 15, 16, and you were approaching to the end of high school, did you want to be a doctor by your teenage years, or you decided later?
I knew I liked helping people, mm-hmm. but I didn't know exactly how to translate that into a career. I think it's really hard because at that age, you don't really know exactly what you want to do. But in Honduras, you have to choose a career path. You know, in the United States, you have the option of doing exploratory studies, which is basically you go into college or you go into a career not knowing exactly what you want to do, and then you can change, which I think is awesome. Mm-hmm. But you know, I knew I liked the sciences, and I think that I was lucky because not everyone knows that. You know, sometimes you just don't know, and that's mm-hmm. the reality. And mm-hmm. for most, as a doctor, I see a lot of teenagers, and for a lot of them, that's actually the challenge, is knowing, you know, you're supposed to know, but you really don't know. And mm-hmm. so my advice, you know, for those people will be to start wondering and getting exposed to what you might find attractive to. Like if mm-hmm. you like the sciences, then sciences, mm-hmm. but if you like teaching or math, that's okay as well, you know. Mm-hmm. And
back then, did you have any mentors, someone that you were inspired? Maybe sometimes people, like, they watch, you know, TV and they say, oh, I want to be like that person. Or you had a teacher or someone in your family that you said, you know, I look forward to be like that person, or someone that inspire you, like talk to you and open you the doors.
Yes, I was lucky enough to have a mentor, which was my uncle. So he's actually a physician mm-hmm. as well, in a small town mm-hmm. where I was raised, mm-hmm. in Catacamas. And so I had him as an example of where I could someday get to. And I know that that's a challenge sometimes for a lot of our youth, is that they don't have a mentor that they can relate to. And so if you don't have it in your family, my advice for you will be look somewhere else, because there are folks like me who are willing to have students, shadow them and experience what it is. And not just me as a doctor, but you can shadow teachers, you can shadow engineers, you can shadow anyone that you may be curious about. And many of the high schools have programs that can allow you to do that. But if not, then seek it on your own, like ask people, like your neighbor, or maybe your mom knows someone who knows someone, maybe your own doctor, where you go be, and seek care, or your dentist, or, just looking for that opportunity, because knowing, in order to know if you like something, is better if you have first experienced it.
Excellent. When you decided to move to the United States, we never asked these questions before, but when was the key point that you said, okay, I'm leaving Honduras, I'm moving to the United States? Did you first move to Indiana, or where else you lived?
That's a great question, Gloria. And I can tell you that I went through medicine school in Honduras, and then I wanted to study outside the country. And I didn't really know exactly where, and so I started looking into the opportunities that were out there. So I knew Spain was one of them, and I looked into that process. I knew some countries from South America, like Chile, Argentina. You can also go there and specialize. And then the United States was the other option as well. So obviously this was a family project, because by the time I did that, I was already married and have 2 kids, which I'm proud of, because I think that, some people may see that as a challenge to continue to grow and develop. And sometimes that challenge can also actually be the motor that makes you want to do something, like your propel motor kind of scenario. So I sat down with my husband and say, this is what I would like to do. He's been extremely supportive all this time, and you have to balance the pros and the cons when you're going to do something, and that's what we did. And so the United States offered many pros for us. One was that my husband and my kids will learn English. Another one was that you get paid when you're doing your specialty here in the United States. And, another one was that in my home country and many Latin American countries, the United States is like, that's the place to go, right? And so we decided to
pursue moving here.
Yeah.
Excellent. What was the biggest challenge for you when you moved here? Did you went to start working for a hospital straight, or did you have to study again? Because I know that's the biggest barrier for a lot of doctors coming to the United States.
Yeah. So for me, the language was definitely a barrier, because my English now is what it is after 12 years of living in this country. And I didn't feel that my English was good enough, but I didn't let that fear stop me from pursuing what I wanted to do.
Excellent.
I think that another challenge is for a doctor to come and study here is a very hard process. So you have to pass several tests that are really hard. And once you pass those tests, you have to apply to a residency program. In my case, it was family medicine, because I was a doctor already, but I wanted to specialize in something, and so I chose family medicine. And then you have to apply to the different programs across the country. Obviously, I was honestly willing to come wherever I had the opportunity. I didn't care if it was a big hospital or a small hospital, a big city or a small city. I was just like willing to go wherever, wherever the opportunity was there for me. I did a couple of interviews, and IU, School of Medicine, was one of the places where I was offered an interview, and they, I loved them because of the diversity that they had in their residency program, and they loved me, and so they offered me a contract to say, come and do your specialty here with us.
In this process from IU going to Eskenazi, now that you are the Chief Medical Officer, one of the top executives in Eskenazi, and probably one of the top executives Latinas that are here in Indiana. How do you feel about that growth? Did you see yourself like going to this position in 12 years since you moved here?
Honestly, I didn't. I started working as a primary care provider in family medicine, and one of the things that really encouraged me to take this path was that I wanted to be a voice. I wanted to be a voice not only for myself, but mainly for my patients, all the Hispanic population, but also the providers, because right now I have the opportunity to be that voice. It was not an easy path, and I said it wasn't easy because you probably have heard this before, but it feels like if you're a woman, if you're a minority, you have to work harder to get where you want to go. And so I started by studying an MBA, Master's in Business Administration at Kelley School of Business, even though I had no leadership position, because I thought if I want to do this, then I need to be prepared for it. And I had really good training to the Kelley program, and I also had mentors through that program. So mentorship is something that is not very common in the Hispanic population. I mean, we have mentorship from our family, and that's great, but sometimes you also need external mentors that are in positions that you want to go to, or that they can help you follow the path that you want to follow, because they've done it and they know how to get there. So your family can be, or friends, they can have all of the love and the good intentions, but they haven't walked that path. And so the advice that they might give you might not necessarily be the best to get there, even though is loved advice, is the best advice that they can give you, but not necessarily turns out in the outcomes that you want. And so I applied 4 times to a position in leadership before I got one.
Wow.
And every time I say, well, this is not my opportunity. I'll keep trying. I'll keep working. And, eventually the opportunity came. And then once you are given the opportunity and you show people that you can do things and they start to see, how you do things, then other opportunities open. But sometimes that first opportunity is the one that is really hard to get. And so my advice will be, keep up the good work, fight for your dreams, be resilient, and don't give up. Like when you see, when you fail, learn from your failure. What can I do better for next time? And eventually you're gonna get there.
Wow, that's very impressive, Dr. Fortín. So you're a mom, a wife, mom of 4. The Chief Medical Officer of Primary Care. I think you're an inspiration for a lot of women, Dr. Fortín. A lot of women, we need that type of role model so we can keep growing, keep pursuing, because I think at the end, I don't want to sound cliche, but the sky is the limit. You never know where you're going to get there when you take the opportunities and you keep knocking doors. Now that we are celebrating the Hispanic Heritage Month, and it's been 12 years, normally as Latinos, we celebrate our Independence Day. How do you take your being from Honduras, Latina, Hispanic, in the United States, working for a corporation that you have so many people around you? How do you bring your Latinidad to your work, to the workforce, but also from home, because you have your family, and it's so important for us. Do you speak Spanish at home? Do you cook your Honduran meals? Do you share with your co-workers? How do you deal with that?
Yeah, well, I'm gonna try to answer the question in 2 separate episodes, but because I think family life is one part of my life and my work life is a different part of my life, although you cannot separate them completely, but I'm going to try to answer the question along those lines. So for my family, I am proud to be Honduran and to be Hispanic, this origin. And we only speak Spanish at my house. And for the kids, sometimes it's hard because, like, I have an 8-year-old daughter, and she will always reply back to me in English. But I always, I encourage her not to, talk to me in Spanish. But it's hard, I understand. But I try my best not to talk to her back in English, because I think it's so important for them to learn Spanish. It's not just pride in who you are, but I think it's also a great skill to have. Like for example, in Eskenazi, we're always looking for people who are bilingual. And so that's a skill, and it can serve you well once you're looking for a job. It doesn't matter what job it is. It's always an extra skill. The other thing I think is important for your kids to never forget where they come from. And even though they were born here, well, 2 of them are, we encourage them to feel proud of what their background is.
Their heritage.
We go to Honduras all the time. We tell them that their grandparents don't speak English, although some of them do, so that they are forced to speak in Spanish. And the meals that I cook at home, my husband also is very supportive, and he also cooks, but it's always Hispanic food. Well, here and there we may have like pizza when we don't want to cook, but that's very rare. And like we keep making at home the foods, even like the typical foods that we eat at home, and my kids know them. And when they're little, they usually don't like it that much, but as they keep growing and the older is out to college, she comes back home and she's like, oh, this food is so amazing, when maybe in the past she didn't think it was that amazing.
That's awesome. We have one of our kids here joining us. But that's so great, Dr. Fortín. Thank you for sharing a little bit about your life, about how you bring everything that you have at home, at work, and how proud you made us. And also, all the contributions that you bring to the influence that you bring to the city and the state of Indiana in the area of health, leadership for women.
And I don't think I completely answered the question, because you also asked about the part at work.
Oh, yeah, yes.
At work, I consider myself to be a role model, and to begin with. But at the same time, I am lucky to be in a position where I can influence, and I take an opportunity for that every single time. Every single meeting, I'm always thinking about how is this going to impact, the Hispanic population? How can we make it easier for the Hispanic population? If something comes up, it's like, do we have this in Spanish? And so there are many opportunities at work to bring my perspective of being a Hispanic, and I think Eskenazi also has a lot of focus in diversity, and so it's not just me as Hispanic, but our groups, our teams, our leadership, from our front staff to all the way up to the leadership team, we are extremely diverse, and I am so proud of that. And that is something that as the Chief Medical Officer for our provider pool, we have increased our diversity significantly. We are one of the most diverse physician groups or providers group in the Midwest. Excellent. And it's not by accident. It's not just because that's how it turned out to be. It's because we do intentionally do that by connecting with the different colleges of different Black and Hispanic background, intentionally trying to attract the diverse provider population, and our staff is extremely diverse as well. So.
Excellent. That's so important. Thank you so much for everything that you're doing through Eskenazi. I think being intentional in your work, it's something that it's from your character, and I see that how you've been working with us in the last probably 2 years when we were going through the pandemic, and Hispanics were not getting all the information, and you were crucial, Dr. Fortín, for us to disseminate all the information, and also with the vaccinations, and to get to the community that was in need, and it was the most vulnerable probably. Thank you so much, Dr. Fortín, for being here, being part of the Hispanic Heritage Month celebration, this virtual series that it's something new that I'm trying, to see if it works so we can make it bigger. I know it's going to be very informative for a lot of people here in the community. Thank you so much. And let's keep celebrating the Hispanic Heritage Month with the Indiana Latino Expo.
Indiana Latino Expo Show.